Good afternoon. We're going to go ahead and get started here. Thank you, all of you, for being here. We've got a few people who I know are coming in still, but we're going to go ahead and get started. They can always catch the exciting first part of this on television later, so we're not going to hold off. Welcome, all of you, today. I'm Maggie Kraft. I'm the Executive Director of the Area 1 Agency on Aging. And many of you know what that is. Many of you do not. We are the local organization that is responsible for planning, administering federal dollars through the Older Americans Act and planning how those monies will be spent here in Humboldt and Del Norte County. Part of that process is for us to develop an area plan every 4 years and to update it annually. And that means going out into the community, finding out what senior issues are and needs are, and collecting data. So we are really excited about this opportunity to work with these students, and they will all explain a little bit more how this came to be. I just wanted to welcome everybody and thank you all for being here. We are hoping that the information we gather here, that has been gathered, that is being shared, is the first step to an ongoing potentially relationship with Humboldt State to keep digging and digging and digging to get the data we need to share with policymakers and government officials here in our community to let them know what the senior needs are. So we're really happy that this is happening and happy that all of you could take the time to join us. I'm going to introduce now the president of our advisory council, Bonnie McGregor, who will say a few words and introduce any members of her council who are here today. So thank you.
So the Advisory Council's role with the Area 1 Agency on Aging is advocacy. Originally in the Older Americans Act, there was a possibility of aging issues being like part of the cabinet or something in government. And when they decided not to do that, they realized there needed to be an advocacy role at the community level. So the members of the Advisory Council Our role is to be sort of the eyes and ears out in the community to help assess what the needs are. And fortunately, part of the Older Americans Act is that there be representation on the Advisory Council from supervisors in the counties in which you are a part. So I want to start with introducing the first member of our Advisory Council, Supervisor Rex Bone, who I'm very grateful to his participation and to his taking time to work with us because he is currently the chair of the Board of Supervisors. In Del Norte County, Roger Gitlin is our representative. He couldn't be here today, but Del Norte is very anxious for Humboldt State to help next year to do the same kind of work up there because we are really excited about this process. There are a couple of other members here today. Mary Ella Anderson. She also is a member of the senior legislature in Sacramento who they work on issues that affect seniors at the state level. And I don't see any other members, but I'll mention their names. Amanda Haney, who is from Del Norte, and let's see. Oh, Sylvia Shaw, who's from Eureka, Tim Marks, who's from Riadel, and Barbara Para from Ferndale, and I live in McKinleyville, so we try to get a representation from different parts of the county. The last thing I want to say is that going forward, as you see, and as we focus as a community, whether we're elected officials or service providers or university people who have knowledge or citizens, seniors, as we age and have a little more time, this surge in the percentage of the population that is going to be over 65 is going to challenge all of us to bring our best knowledge and skills and creativity and coordination to looking at what we can do to make sure that not only people are served with their needs, which we'll need for sure, but also have an opportunity to participate in coming up with ways to meet those needs. one of the things that's been most wonderful for me as I've retired and stayed active is to find that I keep running into people that were in the service community in the area that I worked in my career here, in various careers. I keep running into them still being active in the community, bringing all that wealth of experience and understanding, having learned all the mistakes that we learned to get better at what we were doing, offering that to the community. And so I think that's the bonus of having so many older people is there'll be a lot of good help to go along with the younger people or having the hard work of making it all happen. So I think that's all I have to say. I'd like to turn it over to Maren Rose, who is the planner for the Area 1 Agency on Aging and who has done such a brilliant job of coordinating this work with the wonderful people at Humboldt State.
Thanks, Bonnie. I happen to get lots of email that comes through with various projects and things that are happening in other states and in California too. But some of the things that I was able to look at were this new concept called livable communities or age-friendly communities, which I found kind of interesting. So I did a little research on it and discovered that there's actually several states that have taken an initiative in planning ahead for this aging demographic of baby boomers. And every day, 10,000 people turn 65. And it's a huge impact on communities, and some states and communities are already trying to think ahead, plan ahead, and be more prepared so that they can be proactive rather than reactive. And some of the things that I looked at were the use of technology in mapping, geographical information systems-based technology that mapped some of the people, or in Florida, for example, they used GIS technology to map where seniors were located to help in their planning process. So on a fluke, I sent an email to our local Humboldt State University professor, Yvonne Everett, who teaches the Environmental Management and Protection course, and said, is this something we could find a student who might help us do this? And it turns out that she has a class, a practicum class, that is a senior capstone class for students completing their bachelor's degrees in environmental management and planning. And I was given the opportunity to go to the class and do a presentation about the Area 1 Aging on Aging, this whole concept about this large demographic and what can you help us understand better where seniors are located, where people are located, so that we might be able to convince local government officials and others of the need to think ahead and plan for this. So the degree itself that the students are working on is to give students the skills necessary to understand and manage the ever-changing relationship between humans and the natural world. And I got very, very lucky because I got two dynamic students who were very interested in this project and took it on. And I want to especially thank them and Yvonne Everett, Professor Yvonne Everett, for having a class like this that's such a huge resource for our community. And the students actually have to turn in cover letters and resumes and a scope of work. So it's a serious opportunity for them to practice working with a client. And so without further ado, I want to introduce our two team members. The students work in teams, and we have two people here, Rose Kelly, who's here in the white, and Hannah is operating the laptop in the back. Rose has worked as a natural resource living and learning community advocate and included planning community programs. She's also worked with first-year students. She's also worked with the North Coast Environmental Center as an intern focusing on climate change adaptation. She plans to work on her master's degree in city and regional planning at Cal Poly, San Luis Obispo this fall. And Hannah has worked as an intern with the Humboldt County Planning Department, updating multifamily rezoning of the general plan housing element using ArcMap and ArcGIS skills to map layouts. So we're really fortunate to have someone who actually has the hands-on experience with Humboldt County planning. She plans to move to Lake Havasu City in Arizona to be closer to her family, and I think part of that was to help out with an aging family member as well. So she has also the firsthand, both of them have firsthand experience in working and helping aging family members. Hannah hopes to find employment in a nonprofit arena that is going to enable her to continue to work with the local community on social and environmental issues. So without further ado, I would be happy to turn it over to both Rose and Hannah. Thanks.
Thanks, Marin. We would again like to thank Dr. Von Everett for her guidance and Marin for being such a great client. Hannah and I are both really touched by this project. So we titled our project, I'm just going to grab this. Does that work? Can everyone hear? Good. Our project was spatial analysis of senior and services. So like Marin said, we mapped where seniors lived and where services were to see where continuity, discontinuity, or needs were. Because everywhere, and especially in Humboldt County, we're seeing a growing senior population. And I would like to clarify on our fact sheet, our numbers are based on communities that we mapped, not total number of seniors in Humboldt County. So there are actually 26,000 people over 60 in Humboldt County, and a list of communities and their numbers can be found on the back in graph form. So our mission was to understand the spatial distribution of seniors and services in Humboldt County to assess the need and better plan for changing demographics. Humboldt County is a very large county. It's the size of Connecticut. And so understanding where there are densities of populations and services such as food, recreation, housing was an important first step in understanding how and where to plan. So today we're going to talk to you about how we mapped, some key planning terms, which you can also find on your fact sheet, key issues, housing, and then, of course, mapping. If you need any clarification about the slide that we're on and any questions, we'll clarify it then. But otherwise, we'll have a large interactive mapping session after the PowerPoint is done. So frame your questions that way if that works. So our purpose, we worked with Marin Rose in the Area 1 on Aging to map shifting demographics, at least to understand them, and then mapping boomers and seniors and services. So all of the maps are within 5-year age classes, starting at 50, which aren't considered seniors. Seniors are considered 60 and up by the Old Americans Act. But we wanted to see people that are going to be seniors soon. And all this data is about 5 years old because it's from the 2010 census. So these people are 55 now. Then we did an analytical assessment, so understanding the mapping, but then putting in some planning terms and a literature review of both sociology and planning literature to do some more analytical work. And then our whole goal was that to create a county that could support aging in place with dignity. So as long as people have the ability to live in their communities or their own homes, we wanted to support that. And that was really the guiding foundation of our project.
So Geographic Information System, also known as GIS, is really a mapping platform. The most well used is the ArcMap platform. It's also the biggest and also the most clunkiest, but it is what all the professionals are using, so it is what we decided to use in our presentation or in our project as well. What I found was the largest problem with mapping Humboldt County is just the difference in scales. Humboldt County is very large, but we are mostly rural. So trying to map the entire county almost was next to impossible and get the detail that we needed to show because the areas we're showing the detail are actually very small. We were able to pull, this project is basically taking data that is already out there, spread across many different agencies and organizations and pulling it together. So we were able to use many different layers from Humboldt County that already existed, as well as census data layers and other things.
So key terms, and they can also be found on your fact sheet, but I'll clarify right now. Age-friendly as opposed to elder-friendly. So creating a community that is user-friendly for all people, not necessarily placating towards millennials or young children or older adults, really making user-friendly your base value. And there are some caveats of features that you want for older adults, but generally it's for just a user-friendly, accessible city where people feel comfortable interacting and walking and living independently. Aging in place is the idea of staying in one's community or own home. It really depends on level of need, but being able to stay as independent as possible in a community of choice. A baby boomer is someone born between the years of 1946 and 1964. So not all these people are right now over the age of 65, but it's that big demographic coming up that we have to prepare for. A census designated place is a community that the census has designated. It's a local area that we can define geographically and by name, but isn't an incorporated city. So like Garberville, we all know what Garberville is, but it's not its own governmental unit. And there are 26 of these in the county. There are only 5 cities. So not everyone is mapped, but a good portion of the hubs are mapped. A city is a city. It's an independent governmental unit with a mayor and a council and has its own police force and other services. So it's an area that's more easily served. And there are 5 in Humboldt County, not McKinleyville, but all the other ones you think of, Ferndale, Arcata, Eureka.
The big difference is census designated places are not legally recognized. Cities are legally recognized, so that was just something to point out.
And have their own governance. Mm-hmm. A community service district is it serves water or sewage or other services, but is not a full city. So places that aren't cities, Manila has sewer, but not necessarily city governance. GIS is the mapping that we use that Hannah explained. And then the word senior, we defined as the Old Americans Act as 60 and up, but we mapped 50 and up as of 2010.
So key issues that we looked at were housing, access, and safety.
Yeah, so it's appropriate housing for different levels of care need. Access, so the ability to go to doctors, participate in the community, and get food independently with very minimal assistance. And the ability to do all those things safely. Housing. The key issues in housing are affordability. 1 in 4 seniors depends on 90% of their income coming from Social Security. So there are 2 classes of seniors, those that have more fixed incomes and those who have equity and can live off of investments or their families. And it's a gradient. It's not you're one or the other, but there are a large number of seniors where we have to factor in affordability into appropriate housing, and a lot of that is going to be in multifamily housing. Safety and modifications. So a lot of older homes, their location is too far out of context to walk anywhere, or if you're having trouble driving, to drive anywhere. And also within someone's home, severe arthritis can cause trouble with doorknobs, so you need modifications to door levers, or as you get older, or clumsy like I am at my age, changing light bulbs can be difficult just within someone's home. And then within a social context and location, Humboldt County has a huge sense of place. You know where you are. We're all tied to our community. And so understanding being able to be part of your community as you age, as Bonnie said, is huge. So to bring it home, in Humboldt County, 35.6% of seniors are economically unstable, and that's from the Area 1's plan. And 7.1% live below the federal poverty line. Affordability and understanding where people are going to live is going to be of importance. There's fixed income, Social Security, that's 1 in 4 nationally. I don't know the numbers for Humboldt County. And then women typically live longer than men, and especially for this generation, but mine as well, make less in their working years and have less Social Security to live on as independent adults. There are age-related physical changes. As we get older, we change, and not everyone changes the same way, and we want to admit that, but we use 10 years age classes in our report as a proxy, because it seemed generally 60-year-olds or people in their 60s are different than people in their 80s, but it's not everyone's the same. But as you age, maybe you don't need full-time nursing care institution, but there are physical changes that need to be adapted to. Different levels of care need are important. And then natural hazards. Humboldt County, we are up and on our own a lot of the time, and there are tsunamis and there are fires, and we are resilient people, but understanding where seniors are, especially those that cannot drive, when there are natural disasters is going to be of utmost importance when planning for disasters. Context and location. So single-family homes and Section 202 housing is affordable housing for seniors from the federal government. Most of them are built apart from public space. So if you can't drive, you can't get and interact with your community. So we thought, and the literature agrees, it's not just us, that seniors should be able to access doctors, food services, and recreation independently or with services such as transportation that they could affordably access.
So mapping. We wanted to when we first got this project, it was like, well, where should we start? And what seemed to be fitting was looking where and trying to figure out where seniors are currently located. So what we did is we were looking at the census data, and we were originally planning on taking, can you guys hear me? We were originally planning on taking 2000 and 2010 census data and comparing it, but during that time the census changed how they gather data from zip codes to the census designated places. So that's when we changed our planning to looking into different age groups of seniors to see where different age groups currently live in the 2010 census. The populations were stratified by place because to have community as a people living together, so we decided to focus on where people were already living. And we looked at where services were located by mapping point data using longitude and latitude. So now we're going to go into the mapping. Right. And for the first little bit, this is ArcMap, by the way. This is a really zoomed out view of the county. Just to find my right file here. Right. So I'm going to zoom in on the Bay Area. And this is seniors age 60 to 64 in Humboldt County. By percent. So this is the overall percent of the population per the CDP that they live in. And as you can see that there's a higher percentage of seniors in this age class living on the outskirts of the Central Bay area in Trinidad, Fieldbrook, Pine Hill, Fields Landing, which is this little one down here. I don't know if you guys can really see it, and Manila. When we move up just by 1 5-year age class, we can see that that's even amplified even further and how there's even less seniors centralized around the Bay Area. This becomes important when we look at the services. Because we can see that many of the services, when we zoom in closer to Eureka, are all located very close to that downtown area. And many of these services out here in the surrounding area, the pink squares are residential care, traditional housing right now. So basically to get any of your services in this area, you would have to go into downtown Eureka. When we look at the same area, or same services in Rio Dell and Scotia area, we again can see that this is an area where there's a hub of services, but there's also not a lot of seniors in the area. And if we zoom out a little bit, we can see that the services are higher up. There are others located in Fortuna, but we thought it was important to highlight Scotia because Scotia, Rose is a little bit better about talking about this than me, so I'm going to let her take over.
Scotia was a company town back, Pacific Lumber Company owned it. So the way it's designed is actually very age-friendly just because of the time period it was. The whole community has smaller lot sizes, so they're a little bit easier to get around. And within the whole community, there are services. The town was built to be all-encompassing. So as Scotia becomes, they're not going to become a city from what I understand, but as they get services upgraded, and they're going to have top-of-the-line services up to California code, which not all of our services in Humboldt County are, it could be a really interesting opportunity for seniors to move into Scotia. The housing should be affordable, and the community should be really appropriate for aging in place. So as it becomes a CSD and not a city, it should be a really interesting place to watch. And there are services in Rio Dell and in Fortuna, which in Humboldt County, with appropriate transportation, really isn't that far away. So I think it's going to be a really interesting place to watch.
The other place that we were looking at for services is further down in southern Humboldt. There is not many services. The only hub is actually around the Redway and Garberville area. So that means many people from that area would have to either drive into Redway or Garberville or drive up north to Eureka if they're in any of the CDPs along the 101 to the north. After we mapped the population and the services, we were kind of wondering where hazards were. We were looking at flooding, fire, tsunami, and earthquake, but I'm just going to pull up the flood map if I can find it. There it was. These are some of the CDPs north of where we just were. And as you can see, this is both the 100 and 500 year flood map, which means if it's a 500 year, there's a 0.2% or
0.2%. Well, it's based on the previous flood record. So as many years as we have record, you do a fancy calculation that I used to know by heart, and you get the percentage. So 100-year flood is a 1% chance based on previous years, which is a metric of land use and past climate, which isn't the best to predict new floods, but it's what we have. And you can see that Myers Flat is almost completely submerged in Phillipsville, and can you switch it to by number, 60 and up?
yes.
It's slow technology, but it's good.
I just don't know if the computer can. That is the question.
There we go. So there's not a lot of people in Phillipsville, Myers Flat, and Miranda, but you can see that a lot of these places are well in the flood zone based on previous flood record.
Another important coastal thing is tsunamis. I was looking for a tsunami run-up zone shapefile, and there isn't one really accessible right now, but we were able to find this map, our Power PDF that is done by the Redwood Coast Tsunami Work Group, and we wanted to click on Fields Landing. This, as we saw over here, if I go back to this area. Oh, I should probably go back and, it's not going to let me. This map shows with the overall population by number, and as we can see by number of population, there are a higher number of seniors living in the area, but we also chose to show by percent because CDPs have a very different number of populations in them. I believe Eureka has over 2,000 people, while the Red Crest CDP has 89 people. So showing by number really wasn't necessarily the best factor to show when we were looking at CDPs trying to compare CDPs to each other. So that's also why we have by percent number. So the maps do look different that way, and so I didn't want to confuse anyone with why now the darkest red's around the bay. If we look at Fields Landing, we can see that I have to take off this is a different flooding. Here's the 101 is right through here, like we can see here, and this whole area is the evacuation zone, and a lot of people live there, and I don't know many people who would drive into an evacuation zone to get people. I know there are people who will, but that is just something that we need to plan for.
Yeah, I mean, there are seniors Fields Landing on fixed incomes who may not be able to drive, and I don't know what you do at 3 p.m. when people are at work and the ground starts shaking and you have older adults in their homes. And that's not meant to scare anyone, but understanding that we are at a tsunami risk and people do live in the evacuation zone, understanding how to get people out at all times of the day at different levels of need is really important moving forward. And there are maps, we won't go through all of them, but there are maps for the entire coastal zone of Humboldt County. The Redwood
Redwood Coast Tsunami Work Group.
did a really good job at their their PDFs. It just doesn't go well into GIS.
And going along with tsunamis, something that I have a really hard time mapping is earthquakes. But that is just something else that I have to be thought of. There's a chance that parts of our county could become geographically isolated, and it's just, we need to plan. And I know this is all stuff that people have been talking about for years, but it really does need to be moved forward. And it can be done more than just for seniors. It should be done for the whole community, because we are a community as a whole. Right. That's what I'm missing.
Was there one slide before that? Nope, we're good. Okay. So to conclude our PowerPoint and to start our interactive mapping session, we wanted to highlight the importance of transportation to important services. So as we saw, as a proportion of the population, seniors aren't necessarily living close to services. By number, they certainly are, and that's not too surprising. They live in the big cities because there are large populations there. But understanding that there are going to be a larger proportion of seniors and a smaller portion of caregivers to get people to services, transportating either by dial-a-ride or bus or community support services is going to be important, because we can't serve all of our very small communities just by economies of scale, but getting people to the bigger hubs is going to be essential in having people be able to interact independently in their communities. The second is affordable, accommodating, and safe housing options. So having a variety of options based on what people decide that they need. Now we have people living well into their hundreds, so seniors it's a 40-year age class, and understand it's a diverse age class, and there isn't one solution. And I think that's the way we've been doing senior policy for a very long time. Strong community-based support services. In Humboldt County, I think we really have an opportunity to do that. We're a tight-knit community, and we care about our seniors, so I think that understanding how communities can fill in the gap and advocate and work together is going to be another big piece of the puzzle. And the last piece of the puzzle, because we live in Humboldt County, is going to just be prepared for hazards and understanding with an older population, we might need to make some changes to our plans.
Thank you. Yeah. Any questions? You guys want me to show anywhere specific? Yes?
I'd like to see the tsunami map for Arcata.
For Arcata? Okay. Ah. It's
Yeah.
a lot of the bottoms and up to the, that's 255. Yeah, everything south of Samoa and out in the bottoms. But if you really think about it, the Jacoby Storehouse used to have a dock that came off of it and went into the bay. So historically, that's not too far off, really. We just filled the land in, expecting it not to.
Our sewage treatment plant.
Yes.
Yes. Most of them up here, I believe, are.
One of the things most recently I've been going to the housing element meetings in the city of Eureka and the county, and every community right now is working on their housing element, which is how do you prepare zoning and other infrastructure to make housing accessible and available. And it seemed very timely that we have the opportunity to actually look at where seniors are living at different age groups. So you showed a little bit of this, but could you show like McKinleyville and then what I'm seeing from these, a chance to see these maps, is that as people age, they do either disappear, there's no explanation for where they go, or they move into communities. So when we are looking at a slice in time and saying this is where seniors are living now, and we're not looking at the number of people who are 50 years old and older, because the baby boom, if you're 50 years old or older, or between 50 and 68, you're part of that demographic that's going to be this huge swelling of the number of people here. And those of us who are a little older may still be around. So it's important, but I'm thinking particularly of Eureka, which has so many of the services. How do they, as a city that's providing services to their own constituents and residents right now, how do they look to the place where if they're the only ones with the services, there more and more people are going to want to move in? And how do they plan for that? Those are the kinds of things that I think this kind of data can be very important for. So can you show like McKinleyville, and as it changes over time, and that outlining area?
Yes. The red in this one, there would be more than 2,000 seniors living in that area, whereas the white would be under 500. It's different for different breakdowns on the different slides. So if I changed another one, I'll try to remember to point it out to you guys. If you have any questions, just please raise your hand and let me know.
But it's always a measure of intensity. So the darker it is, the more it is in that category by
Yes.
proportion or by number. So as a metric that way, that's always the same.
Let's do probably, this will probably show it best by percent, you think? Yeah.
Sure.
Oh, yes.
Yes.
Yeah,
Yes.
yeah.
We're grateful to have Humboldt Access here today, recording this, and it'll be able to be shown on on Humboldt Access. But they need questions to come over the microphone in order for it to register. So if you'd raise your hand, we'll bring you the mic when you have a question.
Could you show Fortuna, since that has
Yeah.
not been highlighted?
I'll just go there first, I believe.
I think we were talking about this report. You're seeing it up here, but we do have copies of it, and I think we're going to be working with you to house it, figure out where we house it, so that you'll have a way to access this material and poke around at what they've put together. So you're not going to necessarily see it all today, but we'll have a way to make it available to you.
And I do think it's important to note that Fortuna is the other area besides Eureka that has services particularly directed to seniors. So I didn't mean to slight Fortuna in that way.
Yes, Fortuna does. We had to pick and choose what we were showing. So please, if there's anywhere we're not showing, just let us know and I'll show you.
Hi. Keeping the Fortuna map, could you show the tsunami run-up area?
Yes. Oh, no. All right, well, first I'm going to go through and show just the age classes here in Fortuna. This is 50 to 55 by percent. This lighter pink, I believe it would be between the 4.6% and the 9% seniors. Well, this is between the 9.1 and the 13.5% here in Hydesville. If we move up to the 55 to 59, I could probably have jumped up to a higher class. Oh, that did not work. Sorry. ArcMap's a little slow.
Does that indicate that there are more people, not more people, but percentage living in Hydesville of that age group? And
Yes.
there's absolutely no services listed there?
Yes.
Yes.
Just want to make sure I read that right.
So
That is exactly what that's
Fortuna
saying.
is going to be important for not only Fortuna seniors, but Ferndale seniors and Hydesville seniors. And we are seeing a large proportion there. So understanding how to get people from Hydesville to Fortuna, maybe not in great number, is going to be important.
As we move up in age class by percent, the colors do start to go down just because there's more people that aren't in our age classes than are. So that's also something to consider. But I jumped up to 65 to 69, and we can see that there's people that they're about the same. If I jump up again to 70 through 79, or 75 through 79, again, there's a lot less people by percent. We can also show by number. Here's 75 to 79 by number, and we can see that there's more people by number in Fortuna. It was also something hard just to show, just because by number and by percent shows two different things, and sometimes it works better showing the other one. Yes.
When you talk about services, what do you include? What are the services that you target?
We used the senior Area 1 on Aging Senior Information Guide. This is the new 2014-2015. We originally started this off the last edition and updated it when this came out a few weeks ago. It includes like hospitals and skilled nursing, health centers, either clinics or Alzheimer's care, for example, or other. Mental health are more of places that you could go for support groups, caregiver support groups, and other things. Residential care is more of the typical type of senior living that we're used to now, the institutionalized type living, versus housing resources where you could go to find help with finding housing. We have lunch sites. Food and nutrition is different. That's, again, areas where they'll help you find more than just give you a meal at a lunch site. Also, we mapped home deliver meals hubs. Different home delivery meal programs have routes or areas of services, and mapping things like that. We're only 2 people. There's a lot we could do with this project. This project by no means is done. This is just the beginning.
Will you hover over one of the services to show that we have? Yeah.
And in terms of housing, because one of the things we're talking about is housing here, that the information guide does not list all the potential housing that exists in the community. So each city's housing element where they talk about where their housing stock and all that, that's not cross-referenced here. So we can't show you every affordable house that's not there, but the general service types of things. So
There's also the last few things were more community resource centers, senior centers, and recreation and volunteering, which, for example, were community pools we mapped in our areas that had senior service or something fun directly at a senior. Something to note is we wanted to get into the housing deeper and look at zoning and look at things. But we all know where the Humboldt County housing update is, and a lot of the files aren't updated yet because nothing's been official yet. So we would have been incorporating old data, and it just got really hard to try and sort through what we could use and what we couldn't use and trying to process it all. So we wanted to go in and look more specifically at locations and zoning, but we need to wait till there's a better pre-made layer out there, because I can't make that layer. That would take way more time than the project had.
Would there be a way to incorporate population projections for like 5, 10, 20 years?
Yes, it just would have been collecting the data and doing the processing and putting it in, but that is very much something that could be done. That's kind of something we were trying to do with using the 2010 data, and just since the data was collected differently, you couldn't compare the two to each other.
Because that would be really good for the housing element. I think.
Yeah. If you can put it in a spreadsheet, you can probably put it into ArcMap.
But you can also know that 50-year-olds today were born in 1964. So that's the last of the baby boom. So what they have done by looking at 50-year-olds, even though it's 5 years out of date, you can look at the demographics for your housing elements. If you look at how many people are 50 and between 50, say, and 85, and that in a way is projecting, if you keep the local people local, how that will increase.
That was also something that we had with the population data is there's no way of knowing if these seniors are moving in, moving out of the county, moving within the county. That's not something with the data that we had that we could track. That would be much more detailed data we would need to get before that could be something like that could be done.
And also something that we went to the Eureka City Council housing element hearing, and something to keep in mind is it's not just a matter of gross numbers. It's the issue is that the older people are going to be a larger proportion of the total. So if you're planning for the kind of proportions that we had 20 years ago, it's not going to work. You have to revise your thinking and look at housing in a different way.
Will you
And
that Fortuna
the-
tsunami map?
So that's going. Doesn't look like they went in that far.
The other thing I wanted to say too about it sounds like what you could do are like trend analysis, but there's a lot of assumptions about trend analysis that the boomer group is going to do the same kind of pattern that the senior group has done, and that there's not going to be another recession or depression that's going to impact everything. So you have to be kind of careful with trends and projections, and kind of keep in mind, balance it against, you know, the limitations that data has.
Yeah.
Let me see if there's anyone else wanting to grab this.
I was trying to pull up the Fortuna tsunami map, but it seems like they don't go up that far.
Yeah, because there's.
But this is the closest. Fortuna would be off here to our right.
So thinking about services, it seems to me that most of the services that most seniors use are the same as the services that everybody uses.
Yes.
And so everybody goes to the grocery store, everybody needs access to health care. Frail seniors, a lot of the services you identified are really targeted to more, more frail or vulnerable seniors, which is really only a relatively small percentage of the total senior population.
Well, I mean, I think all these services are for everyone, and though we are focusing on seniors, the overall is age-friendly community, and that's more than just seniors. And as you stated, that everyone uses these services, and for them all to be located in a few areas isn't really fair to everyone, in my opinion. Mike, and
Pull up maps on the 80-year-olds and older, because we
Yes.
can kind of operate on the assumption that that group is probably a more frail group, and that's a pretty interesting thing to look at. 80 or 85.
we'll go 85 and up. And we'll do it by number, actually. That will show it better.
Maybe look at Eureka, because that was in Benbow. What I recall when we looked at that before, that the 80 and older tended to be on the outskirts of cities,
Maybe that one doesn't.
more in the
show well.
suburbs.
We found them in Myrtletown, which makes sense. There's a lot of assisted living care there, and that it's an assumption, but it would make sense that they would be in more institutionalized living, and that's where you'd see the concentration thereof. But as far as normal services go, yes, everyone uses services, and we don't want to say that seniors need their own segment of services per se, but general services such as grocery stores or those sorts of things should be incorporated in normal planning operations. So city plans are and the GPU, although that's not going so well. But that's where it should be taken care of. And our project was more piggybacking off the fact that we're assuming that there's traditional planning going on, and then how do we expand that just for senior services that do placate to a more frail group.
And I don't know if I completely agree with, no kidding, that I completely agree with Alan, because some of what happens is it's not just the frail seniors that need better access to services. Some people end up using services that are intended for more frail people because they don't have other options. They may end up living in residential care or a nursing home because they can't get the care they need at home. They can't get to the grocery store, so they end up living somewhere where they get the food brought to their bed. And the cost for that is much higher than if they can get to the grocery store. So I don't think good access or better access or easier access to some of these services are just for the frail. I think it's keeping people able to go out and do things easily. If you want to stop driving not because you're frail, but because you don't think your eyes are very good, and you can't get to a grocery store without driving or having someone take you there, then you become dependent on other people before you need to, simply because you may not be able to see well enough to drive. So I think, and to me, that doesn't make you frail necessarily. That makes your vision poor. So I think there's a lot of levels of need as seniors as we age and our lives change. So, rebuttal. Hold on.
I agree with you, Maggie. The thing is, you can't put a grocery store everywhere. There's the market requires a limited number of grocery stores, and you put them where the market is. I think this has a lot to say about the general plan and the housing element and all that, because as you look ahead to the relative growth of seniors in the community, I think it becomes really important to think about where you put the housing in relation to existing services, and that you build communities that work for seniors and for everybody, and you build them where there's access to services.
Yeah, I wanted him to be able to say that.
Just an observation. This is a great planning tool and compliments to the students and the area agency for supporting it. It seems that if we know that we are going to have more seniors in Humboldt County in the future, that will be a larger percentage of the population. As Alan said, if we're going to be planning, overlaying those statistics on the map, and we know that we're going to have more seniors, we know that we're not going to be building schools as a priority. We also know that we're going to be needing to respond to that group, and in part it's kind of market driven, because seniors will have disposable income for the most part. They may have equity in their homes, that sort of thing. So they'll be a big piece of the marketplace in Humboldt County. And I think if you get the economic engine going too, seniors could tend to get more response to their needs in the future.
So in a sense, it's almost two things. One is the kind of housing close to services, and one example could be the new housing in Arcata right across the street from the co-op, which is really allows the seniors that live in that housing to walk to a lot of different services that are right downtown, and it's very accessible for them. And another aspect is to enhance the opportunities for public transit or special kinds of ride services, so that people from maybe from Benbow could get on more often get on a shuttle that goes up to Garberville and so forth to achieve those services. So there are at least two larger approaches to addressing those issues.
Yeah, this isn't just Humboldt County. This is the entire nation is facing this. We have our very spread out suburbs, and everyone's kind of realizing that it's no longer what the majority of people want to live in, nor does it really fit the majority of people's needs. So, but it's also what we have. So we need to look at what we currently have, which is kind of what this project started out being, and about where we got to, but we wanted to take it to what we could have. Due to time limitations, we didn't quite get that far with it yet, but we're hoping it makes it a lot farther. But to have any idea what to do, we had to look at where people were, where services were, to even get a base idea. So this is our baseline with the best data that we had for now. I mean, but there were some great points made. We can't have every services in every CDP. It's not economically feasible, and we understand that. But it is economically feasible to move people on public transportation from other places into the hubs. And it is economically feasible to rebuild what we currently have and use our historic legacy to make our futures better.
Well, and the other thing about market share is there was just a big planning conference in Atlanta, and the one thing that I saw coming out of that was it was a one-sheeter about comparing my generation, the millennials, to seniors. And the sort of things we're talking about, livable communities, more mass transportation, is something that both age classes really wanted. So it might, it is looking at everyone. There are some things like maybe more bathrooms or larger font that are a little more senior oriented, but I'm totally down for them, so really they're not. But I don't think we need to be aware of seniors and the problems, and it's definitely close to my heart, but I think it's a mistake to brush off people of my generation saying that they won't use these things either. I don't like using my car. I can't afford it. Have you seen the price of gas? So looking at larger planning context, it is happening everywhere, and it's happening to all of us. So creating these places and being able to have that context, it really is for everyone.
Maybe the time of suburb building large houses on big pieces of property might not be what either generation is looking for anymore.
One thing we haven't talked about is the kind of graduated care that's needed. So along with housing and access to health care and transportation is caregiving. And I know this has come up in the county housing element, and it came up last night in Eureka as well. People have talked about secondary units as an opportunity for people to stay near family, or in one case I have a almost 100-year-old friend who actually moved into the caregiver's secondary unit so that the caregiver family could take care of her. So that's been talked about in terms of affordable housing, but that if you do that too rurally, then you run into the issues of transportation to other services. So that's, but it is that kind of part of looking at the full spectrum. Also thinking of the situation now, where the elders are still part of the people who have been in Humboldt County much longer. And there's a culture here. It's in the tribes. It's in some of the longer-term rural and city communities where people took care of each other in the families. And there's a big question about whether that's going to be still something that's happening in the future. So those are the kind of questions we can only answer in the communities ourselves. We need to know each other and know our communities well, and adapt to what works for them. And the last thing I want to say is, as I look to the future of wanting to stay here, what I don't see, and it's both an economic opportunity, but it's a real need, is graduated care in terms of housing with caregiving connected to it for all ranges of economic ability. All the residential care facilities now are out of my range, and they are for a lot of people. So how do we find a way to care for each other? Maybe we bring it into smaller units in a cluster of a core community like they're doing in Fortuna, and some of us like to see in McKinleyville, and then have caregivers come and serve a lot of people in that area. Or maybe we continue to build these graduated care facilities, but those are very expensive. So I think that I just wanted to add that component to what we're looking at.
This is also playing off on the things that the millennials and the baby boomers have in common. Is we could look at this in a different way. The reason a lot of services are priced out of the range of so many older people is because it's a for-profit system. So the community has the option here to go to something more cooperative or nonprofit, not driven. A lot of people are thinking of the increase in the population of older people as an economic opportunity, but it's an opportunity to build a friendlier community for everybody. It's not about profit. It's about how we want to live together.
Yeah, the growing number of seniors is a social opportunity. Retired adults often volunteer in the community. They're an integral part in the community. So, yes, they're economics, but keeping older adults in their own homes and as part of our community is a gift to my generation and everybody else because they act as caregivers, they act as volunteers. So it's also a very big social opportunity to keep people in their own homes and in their communities.
Is there any more questions or any more places we want to look at? Myrtletown? What age class are we on? Let's, by number or by percent?
That's 60 by number. That makes sense.
Okay. This is the overall age 60 and up by number. So we can see that by number, yes, there are more seniors in Eureka, but by overall percent, there usually is not. We could, does anyone know what age class maybe they want to look at or? 65. Okay.
You know, the other thing that's interesting about this in terms of housing is I've noticed it in Myrtletown area, but also in Henderson Center areas, how many houses are on the market. And I've talked to other people about this who live in these neighborhoods, and we know the people who used to live in these homes, and many of these are seniors who have moved out of the home. Either they've passed away, they've moved into facilities. So the other thing that's going to happen in terms of housing is the turnover of these homes when people are either dying or having to move out. But let's assume they stayed there, and then the houses are being sold. Many of their children are not moving into the homes, they're selling them. And so there's this market. I mean, there's these houses that are getting back into the market, and then maybe that's where a focus, you know, the keeping those houses in the market and filling in some of these areas near services as a way, instead of thinking we have to build a bunch of new houses, you know, that just make sure that we're recycling what we have in a really good way.
A single family home can be turned into a house depending on the size bedrooms, but an average 3 to 4 bedroom house could house 2 to 3 seniors with a caregiver if it's has been modified the correct ways, has modifications to the bathrooms. So these easily could be popped up anywhere in any of these homes.
You're seeing that in San Mateo, which is in the South Bay. They're doing repurposed. They take the old housing stock and they make it so multiple people can live there. Change your doorknobs and the bathtubs, make it more feasible, and then you can have, and it's more affordable. Your rent is down to a room and not a whole house, and you have community.
So this is age 60 to 69 by number, and then if we go up in age class, you can see it's drastically starts to drop the percentage of seniors we have. What are the number? The number here in Eureka right now is between 100 and 500 people, and in Myrtletown's between 100 and 11. Bayview's down between 0 and 10 people right now. Also, there is this hole here.
We don't know.
I don't know. I've tried to answer this question. The best answer I can get is this weirdly laid out Eureka CDP. That is the city of Eureka's out barriers as well. And these other areas are they asked people, what do you consider Bayview? So this is kind of like they just asked the people who live in the greater Eureka area what they consider these areas. I don't know why there's a hole here. I've tried emailing, I've tried calling. That's something that's going to have to be figured out later. So there's definitely homes there. Pine Hill? Okay, maybe we'll get another CDP. Maybe that's what will happen, but I don't.
Are we, and what I see is people leaving this area because we talk about the senior housing and the seniors, you know, aging, the numbers, the number we hit the other day that in 2040 the percentages climbed dramatically for our senior citizens, is they are moving. We've lost all the equity refugees because our housing has dropped not as much as some of the Bay Area and Sacramento prices. A lot of the people are going down to Sacramento and areas where they can have acute care same day, go home the same day, have services, because the biggest fear of people between 60 and 70 right now is as they grow older, we're not getting enough doctors to take care of them. And the wait, if you're a frail senior and you're waiting 3 weeks to go in, that 3 weeks may not come. And so what they're doing is they're going down south where they can get, where you've got larger medical facilities that can actually take them on. And I think the last 6 or 8 people I know have left mainly for medical reasons, because they don't think they're going to have the medical care. And the housing is a huge issue, and there are some things coming on in the forefront in that. But I think one of the biggest things is, if we find somewhere to live, the services is a box, but if they can't get into that box to be treated, it doesn't matter if you're in Petrolia or in, if you've got 4 weeks before your next thing, you got a long time to get in. So they feel more comfortable staying with a family member rurally rather than coming to town when they may not get the service. So, I think that's something, I think that's probably the larger elephant in the room that we don't seem to address as often as that, is the scarcity of doctors to take care of our seniors. And all the seniors that I'm really close with and everything else, quite a few have left, and most of them go out of the area for their services. And I know it was mentioned about bringing a nonprofit in to do things. St. Joseph's is the largest nonprofit probably in the county, and I don't know where we're going to get that issue of affordable sociability to taking care of your neighbor without the access to medical care.
I actually did some research into doctors not wanting to come into Humboldt County, and it seemed to be that the number one reason was there wasn't anything for their families here. So we have to make this an age-friendly place for all ages. We have to have places that they'd want to raise their kids at. We have to have jobs for their spouses. I don't know how to do that. I cannot give suggestions sitting right here, right now. All I could say is that it's a start knowing who we currently have and what we currently have, to start figuring out how do we do this as a community. Because we are a pretty awesome community. We're a pretty awesome community of different communities that seem to work together, sometimes better than others, but we work together pretty well. So we should be able to work together and overcome this.
I think this point that Rex gets to is kind of what Maren mentioned earlier, is you have the data, but that you don't know how this will trend. For a while, a lot of people moved here, young seniors, healthy seniors, had a house in the Bay Area, sold it for a couple $1 million, bought some nice thing here for $400,000, property, life is good, start aging in place, life is okay, need health care, gets to be problematic. And I think there are people living here who may move away from here and are moving away from here for the very reason that Rex mentioned. So the other thing that could happen is the influx of baby boomer refugees who have come here may hop away from here down the road a little bit, and the seniors that we're going to be seeing here who stay and stick it out are the ones that were born and raised here, or their kids are here, or they're something. But these are things, it's really hard to look at the social part of the, this is data, interpreting it and what it means. But I think those are real issues. I think the healthcare is a huge issue, not just being close to where it is given out, but being able to get in the box, as you said, when you need it. So these are factors that I think all of us, and I think younger baby boomers are more mobile as a group, maybe, than the older baby boomers. And we may see some younger baby boomers saying, okay, I love Eureka, I love Humboldt County, but I'm going to go where I can get the service that I think I might need. So we just don't know.
My only comment about that is that the proportion of people who are aging is happening everywhere. So, right now you can go to the Bay Area or Sacramento and get it, but as the baby boom comes on in those communities, what's going to happen? So it's a big unknown.
I think the healthcare is actually across the entire community because I know it affects the college students. We get turned away left and right. If the school can't help us, it's like, okay, go to the emergency room. The emergency room half the time will tell you to drive to Reading. It's kind of like, or go to Reading for the proper treatment because they don't have it at our current hospital. So it's more than, this is more than just seniors. This is for everyone. And it is everywhere, very much.
I think one of the things that we're going to do next is try to talk to some actual people and find out what they think.
Yeah, this is very much just data that we've pulled. It's not even, it's hard to interpret because there is so many different ways it could be interpreted. I personally know kids who have moved up here and are trying to stay, and now their parents who are seniors are moving in and planning on living the rest of their lives here because this is where their kids are planning on staying. At the same time, there's people who are moving out for different reasons. We have no way of measuring that in this data. To really get into trends and to really start to look into making those types of informations, we'd have to do more data research, I think.
So the Area 1 Agency on Aging is responsible for doing an area plan, and the area plan itself is a 4-year document, and you do an update on the interim years. So the current plan we're working with is between 2012 and 2016. We have one this year and then one more year, but in the next couple of years, we're hoping to do a survey, and in an ideal world, it could be tied geographically, at least by zip code, even though, maybe we can figure out a way to make that happen to where we can get feedback from the people who complete the survey to give us more information about what their wants and needs are. And so kind of seeing this as a first step and hoping we can build on this. I want to let everybody know that we do have some handouts up here. We do have our senior information guide and another document if you're interested. It's called Aging in Place, a toolkit for local governments. And you're welcome to take that. And if you didn't sign the sign-in sheet, could you do that and let us know if you're interested in being on a mailing list to continue to receive any information about aging in place or any of the issues that we talked about today. Do you have a question? Okay. Anybody? Any other comments or questions? Okay. I'd like to thank both Rose and Hannah for all their hard work.